positive pressure is good if they cannot take deep breaths themselves and they already have atelectasis. So, incentive parameter is to prevent atelectasis. IPPB is to treat atelectasis. Okay. So, when you're starting in IPPB, you're thinking, oh, patient probably already have atelectasis. What is atelectasis anyway? Correct. By the way, I read yesterday that adult male have 20 million alveoli in their lungs. Female, I don't know.
Oh, so you look at the female.
I was about 10 million. I'm just guessing, but I don't know. But 20 million is what they said. So if you collapse about 10,000 or 20,000 or 40,000, you can have issue, right? And how can you have this atelectasis? When do you actually get it? What kind of patient?
Immobile, maybe? Elderly, immobile, like the man on bed?
Correct. And how about those patients that coming back from surgery? Mm-hmm. And they are not taking deep breaths because of the pain issue, surgery. They don't want to take deep breaths. They just lay there and they don't do incentive parameter right, and or the therapist going in there and not teaching them right. They end up with atelectasis, collapsed lungs. All right. So indication for IPPB is to treat atelectasis and improve delivery of medication. Wait a minute. Can you give medications with IPPB? Certainly you can. See this? See this nebulizer? You can put your medicine right in here. Albuterol, whatever you have. Put it on. Every time I take a breath, the machine nebulizes the medicine and I get the air and the medicine at the same time. So it's forcing the medicine down in your airways. With the jet nebulizer, what do you have to do? You ask the patient to take a nice slow deep breath, right? But this one, it forces it in. It forces that air into your lungs, right, with the medication. So, you can improve delivery of medications and improve cough and expectoration. Wait a minute. How can an IPPB improve cough? Yeah. Right before you cough, what do? Take a deep breath and cough. So, if this making you take a deep breath, what are you going to do? It makes you cough. Okay? And the next one is treat acute pulmonary edema. Positive pressure helps with the pulmonary edema. What is pulmonary edema? Fluid in the lungs, in the alveoli, right? So, how can you have pulmonary edema? What's the issue? Heart failure. Fluid is backing into the lungs. So, if you got a lot of fluid sitting in your lungs, and the positive pressure can squeeze this fluid out away. Okay? Exactly. It can squeeze, this fluid can be pushed out the way so the oxygen can enter. It might be pushing it out to different areas, maybe backing up into the right heart or back into the body, but it tries to improve oxygenation by pushing it in the pressure. Okay? All right, the next one is slow vital capacity less than 10 ml per kilogram. What is the normal vital capacity? 65 to 75. So if the patient's getting less than 10 ml per kilogram vital capacity, you need to start an IPPB therapy. Okay, that's way low actually. Inspiratory capacity less than 50% on incentives parameter. That means you do an incentives parameter, your predicted is 2,000 and you're getting up to 1,000, that means you're only getting 50% of your predicted, correct? You would suggest the doctor, hey doctor, patient only getting 50% of the predicted and he's not taking deep breaths like he's supposed to. I suggest IPPB therapy. Okay? Any questions so far? Keep going. Contraindications, next page, number 2. Okay, tension pneumothorax. If you do IPPB with someone, it can cause tension pneumothorax. Pneumothorax is what?
Air inside the
Yeah, air in the full space and collapsing your lungs. So, if you put too much pressure in someone's lungs, it can cause pneumothorax, collapsed lungs. ICP higher than 15 millimeters of mercury. What is ICP stand for? Intracranial pressure. If someone with the craniotomy, some kind of brain surgery, and their pressure is already high, and you give them IPPB treatment, that can increase their intracranial pressure. So you do not want to do it. Alright, hemodynamic instability. If you give positive pressure to patients, it can cause decrease in venous return. Think about it. Your lungs have more pressure and the blood is trying to flow from your body back into the right heart, coming, trying to move across the lungs, and the lungs have a lot of pressure. It is pushing the other way. The blood cannot come anymore because you have too much pressure in the lungs. What happens to your blood pressure? It goes down. Yeah, your blood pressure goes down.
But doesn't your body try to balance itself out and increase the heart rate?
Yeah, I thought it should
Does the heart like increase the heart?
Yeah, the heart rate will increase to keep up with the cardiac output. But positive pressure can cause that decrease in blood pressure. Hypotension. The hemodynamic of that is blood is, the pressure is right there in the lungs is pushing the blood cannot come through anymore because there's too much pressure in the lungs. You all understand the circulation, the heart, lungs, circulation? Yeah. All right, now, tracheoesophageal fistula. IPPB can cause tracheoesophageal fistula. What is that? It's a hole between your trachea and the esophagus. It's a hole between your trachea and the esophagus. Yeah. That means when you breathe in, some of that air is going to go in right into your stomach instead of lungs. So if you push in too much pressure in someone's lungs for a long time, it can cause the tracheoesophageal fistula. Active hemoptysis. If the patient is continuously coughing up blood, would you want to do this one? No, it can irritate more and bleed more. Hemoptysis is coughing up blood. And nausea. If the patient is already having nausea, would you put positive pressure into their lungs? And it can actually cause nausea because some of that air can get into the stomach and make it nauseous. Air swallowing. Yeah, some of this air will go into the stomach. Active untreated TB. Positive pressure, untreated TB. What has a connection?
Cough.
Yeah, it helps. Actually, the positive pressure with the TB patients, it can push that infection out to different organs. It can spread it. And radiographic evidence of blood. What is a blood? It's like a lung blister. So if you put pressure in the blister, what's going to do?
Burst.
It's going to burst. So you looked at the X-ray. There is a blub, and you go in there and do an IPPB. Next thing you know, patient cannot breathe, short of breath. What did you just do? He popped it.
Now, would that be a pneumothorax then, or is that?
No, it's not gonna. It's not really a pneumothorax. You just pop that blood in your lungs. Pneumothorax is basic.